During this short video, you will see what equipment will be available for you to use during your scenario, and we will also look at the main features of the mannequin that we are using. This area is designed to replicate an emergency department or AMU setting. You will be told at the start of your scenario the exact setting your scenario is based. There is a PC available for you to use. This is connected to the intranet and to the internet, so you are able to use any care pathways or guidelines that you would normally access in day-to-day practice. Currently, we are not connected to EPR, so you will not be able to access any patient information through this. You will also not be able to access any results via ICE or View System 1, as these are live systems and therefore cannot be used for training. If you need any additional information that you would normally source from these areas, then these will be made available to you. All paperwork is kept in these filing cabinets and is available for you to use. For example, we have news charts, drug charts and fluid charts. There is a telephone available for you to use. The telephone number for switchboard is 201, and this is also written on the back wall. Once connected to the switchboard, please ask to speak to the person you require. They will either be available or will call you back. Please do not worry if you misdial whilst using this phone. This is an internal phone only, and only people within the simulation centre will answer. If, as part of your scenario, you need to make a crash call, then please still use the number 201 instead of 2222. There is a drug cupboard in the centre. We do not have all the medication available, but we will have the main groups of medicines that you will need. The focus, however, will not be on whether you have the correct medicine in your hand, but that you have selected the correct medicine, prescribed the correct dose, and using the appropriate route. In this trolley, the majority of consumables you will be required are stored. You will notice that the majority of this equipment is out of packaging and possibly out of date. Please do not worry about this, as we reuse all equipment and the majority of our supplies is out of date stock from wards and departments. The top two drawers contain airway and oxygen equipment, and the second drawer contains blood bottles, syringes and cannulas. Third drawer are IV fluids. We reuse all IV fluids. If you want to use IV fluids, then if you remove the bung out of the top of the fluid bag, please do not throw that away, as we just refill these with tap water and use them. However, put a giving set in, again out of packaging. Please do not tip the bag up, otherwise you will end up with wet feet. Put the giving set in that way around and then invert the bag. So this screen here will work as your Dynamat. It will display your patient's heart rate, your blood pressure, the oxygen sats and the respiratory rate. Generally there will be a member of faculty in the room to help you with this piece of equipment, as we're not expecting you to be experts on the simulation equipment. So we have an emergency call bell, and that would work in exactly the same way as it would do in a ward or clinical area. There is a crash trolley available to use, and this is laid out in the same way as they are in clinical practice. Please be aware, however, that this is a live defib and not a training one. So bear this in mind if, as part of your scenario, you are required to deliver a shock to your patient. All the mannequins that we are using are able to receive a shock. So this is Simman 3G. He is a high fidelity tetherless mannequin, and he's the mannequin that will be going to be used for this session today. So one thing that we can't change is the colour of Simman's skin. Sometimes obviously in clinical areas the pallor of the skin changes, but we cannot simulate this, and this is what we would class as simulation artifact. So his eyes can be open, he can blink spontaneously, or he can have them fully closed, or they can be half open, half closed. His pupils will also react to light. If you pass the light source across the eyes, then the pupils will react accordingly. He can have either normal pupils, pinpoint pupils or blown pupils, and it's important that you check both eyes because depending on the scenario he could have either one pinpoint or one blown and the other one normal. So you can insert a nasopharyngeal airway. He can have any type of oral airway inserted, and he can be tubed if necessary depending on the scenario. So Sinman can have tongue edema, so this is his tongue in the normal state, and then with the edema you can see the difference between the two. So Sinman also has cyanosis, and this is simulated with blue LED lights in the mouth. So Sinman has got pulses. He's got a carotid pulse and he's got a radial pulse, which is slightly higher up the arm than what you would expect. Sinman only has a pulse in the left hand side, as this arm is an IV arm. So Sinman has bilateral femoral pulses, and these are the most easiest pulse to feel on the mannequin. So Sinman has heart and he has chest sounds, so it's really important as part of your patient assessment that you have a listen to the sounds. So if at any point during your scenario you want to attach your patient to the defib, then instead of using the normal defib sticky pads, Sinman has special adaptations. So these are on the crash trolley and they just clip to the press studs on his chest wall with the plug attaching to the defib in the same place as you would the defib pads. So these pads will be kept in the bottom drawer of the resus trolley. So Sinman can also speak to us as well. So hello Sinman, how are you today?
Hello, I'm fine, thank you.
So to move Sinman, it's easier to move him on the trolley. So the trolley will sit him up or lying down as necessary. Please don't try to move Sinman yourself. He is incredibly heavy and you're more likely to do yourself damage than actually move him effectively. Try not to use the yellow handle at the top of the bed, as this does not sit the trolley up or lying down. What it does is it drops the head of the trolley off. So if as part of your patient assessment you wish to record observations, you need to put a blood pressure cuff onto Sinman's arm. You don't need to attach this to anything, as the person controlling the mannequin will realise that you want a blood pressure and this will be displayed on the monitor. However, you do need to attach the SATS probe onto his finger for the result to be displayed on screen.